I detected it through self-examination for over a year and then decided to finally get it checked out after school ended.
12% of women will develop invasive breast cancer in their lifetime.
Because of the breast density that I do have, I would always get abnormal readings. So for me, it was just like, oh, this is routine.
Each year in the United States, about 233,000 women are diagnosed with invasive breast cancer.
I wasn't too surprised once I got the results, just because I had been feeling on it for an entire year.
Finding stage 1 breast cancer, it was a triple negative breast cancer. To be honest, I can't say that I was numb. It was just like, oh, okay.
Having a first-degree relative such as a mother, sister, or daughter who has been diagnosed with breast cancer doubles the risk for developing breast cancer.
My sister was the only one up until, my diagnosis. What is it? Is it the food that we're eating? Is it the environment? Because we have no history of breast cancer in our family.
5 to 10% of breast cancer cases are due to inherited genetic mutations.
I knew that my aunt had the mutation, but I waited to get tested until I was done having children because I didn't want that to impact my decision to have 2 children. When I found out my dad had it, I only had 1 son at the time. Once I found out I was positive for the BRCA1 mutation, I chose to have prophylactic bilateral salpingo-oophorectomy and hysterectomy, which is where they take the ovaries and fallopian tubes.
To get that, I call it a blow, it's different. It's different. It's nothing that I don't feel that anybody would even want to, receive that news. But, I believe in higher power. So, my faith, I use that faith roadmap and just keep moving forward.
Here at Wake Forest Baptist Health, we work towards supporting and caring for every woman who is diagnosed with breast cancer.
When a patient receives their breast cancer care at Wake Forest, they have all the resources and physicians at their disposal based upon their diagnosis.
Especially since this is a preventative surgery, you sort of feel like there's nothing wrong with you, why fix something that's not broken? But again, the testing, multiple tests a year to see if you have cancer really wears on you. And just sort of feel like you're a ticking time bomb, and especially as I got older.
The breast cancer loop remains open until a woman is informed of breast reconstruction options.
With being diagnosed at Novant, the nurse navigator made the contact at Baptist, and then I received a phone call to set up an appointment, and I met with Dr. Levine there. I was surprised. Dr. Levine actually called over to plastic reconstructive surgery, and the doctor walked over from Janeway Towers to the Comprehensive Cancer Center and met with me. And I thought, that's saying a lot right there, just to give me some ideas of what options that I would have going forward.
Women considering breast reconstruction are going through a very difficult time in their life. Participating in reconstructive breast surgery is very fulfilling because we can have a very positive effect on a patient's life whether or not they decide to go through breast reconstruction.
Before I met with him, I was very nervous and had a lot of anxiety. After talking with him and him taking the time to really go through and make sure he answered all the questions, that he addressed all the potential risks as well as the different outcomes. And he also really encouraged me by supporting my decision that it was a good decision to make for my own health and for the future, so that I would be there for my children, my family.
We understand that speaking about these types of operations can produce fear and anxiety. Our goal is to give you as much information as possible so that you can make the best decision for yourself and allay those fears and anxieties.
When I left, there was just a huge sense of relief that I felt like he was going to do a great job. He saw me, he heard what my fears were, and gave me all the information in a way that was really easy for me to understand. It wasn't overwhelming. It was clear. There were a couple choices I still needed to make that he outlined for me to do a little bit of additional research so that I was informed about all the options available for me.
Dr. Pisana shared the different options, but nipple sparing was not one of them because we did not know at that time if I was a good candidate for it. I discovered nipple sparing on my own because I knew ultimately it would be my decision on which type of reconstructive surgery I would decide.
Our goal is to educate, engage, and empower women to make the decision that is best for them following a diagnosis of breast cancer.
One of the biggest strengths of breast reconstruction at Wake Forest University is that we are part of a multi-disciplinary team that takes care of the individual patient.
The Breast Care Center at the Wake Forest Baptist Comprehensive Cancer Center blends the services of a multidisciplinary team in a central location, giving patients access to multiple breast cancer specialists during a single visit.
Being a board-certified general surgeon and plastic surgeon, what's drawn me to reconstructive breast surgery not only is the positive effect we have on our patients, but also the ability to participate in the patient's care from start to finish.
We provide individualized treatment plans based on your clinical, imaging, and laboratory findings, as well as your own unique lifestyle and preferences.
My breast cancer was in my right breast only, and I decided with consulting my sister, because by her going through that journey, she did a lumpectomy. Hers was in one breast, and then 2 years later it came back on the other side. You have to be comfortable with your decision. That's the most important thing. So I just decided to do a bilateral mastectomy.
Particular reconstruction instead of, let's say, implants or a lumpectomy. I definitely wasn't going through a lumpectomy only because I had gone through the biopsy and I had to go through it twice. So the double mastectomy was a choice for me, and then the mere fact I qualified for the deep flap was just a bonus as well. So
I'm about 12 weeks out from a prophylactic double mastectomy with immediate reconstruction. Everyone actually at Wake Forest was very encouraging and supportive of me doing this surgery preventatively.
Our compassionate and caring multidisciplinary team work together to give each patient the right combination of advanced treatment, access to the right resources, and above all, hope.
They did an awesome job of showing support, comfort, being responsive, having a caring nature. And you're constantly exposed throughout this entire process. And I realized early that you're going to have to kind of get over your shyness. It made you feel as though you weren't being exposed. You were being helpful and, teaching in the process. You got to be a small yet large component. They were constantly reassuring. They were a joy to work with and be a part of. So that was a unique experience that I hope everybody gets to take away from it.
I just felt really comfortable with the whole process. He recommended the surgical oncologist who did the actual mastectomies. They worked together as a team, and I just felt really good about the whole procedure, and I've been very happy with my results as well as my entire recovery process.
I will say that my treatment team, and when I talk about my treatment team, let me tell you, the plastic surgeon, the general surgeon, the nurse educator, everybody communicated with one another. You know how people say you have to be your advocate? I think your team is your advocate also. So I think if you're working together, like I was fortunate enough to have an amazing team here at Baptist Medical Center. I was like a leaf. I was so supported.
I did the healing process, then decided I wanted to, go out and about, knowing that there are people out there that will see you, that remember you one way and then turn around, ooh, what happened? So, yeah.
It's been a really positive thing, and I feel great.
I don't want the new normal. I want, I want me. So that nipple sparing got me as close as possible, because I didn't lose any breast skin and I did not lose a nipple. So I'm happy.